Sorry. Okay, you can go now.
Okay. All right, we'll call to order. And can we have roll call?
Dr. Moore,
Yes.
Ms. McGregor, Dr. DeGuzman, Ms. DeWitt,
Here.
Mr. Adamson, Mr. Griffith,
Here.
Ms. Johnson.
Here.
Okay, so we have a quorum. All right. So we'll proceed. Additions or adoption of the agenda. Are there any additions or modifications from anyone? Okay, hearing none, I ask for a motion and a second to adopt the agenda as presented.
So moved.
Second.
Okay, no discussion. Could we have a vote? All in favor, say aye.
Aye.
All opposed, same sign. Okay, motion carries. All right, could we have approval of the last meeting minutes of April the 16th?
So move.
Second.
Okay, and have a motion. Thank you very much. Is there any questions from anyone? Okay, could I have a voice vote? All in favor?
Aye.
Aye.
All opposed, same sign. Okay, motion carries. Public comments.
I have a comment about one of the public here.
Okay.
So Dr. Morrison, Dr. Ann Morrison is here. She will be our new Board of Health member starting next
Wow.
month. So I didn't prep you for this, but would you like to tell the rest of the board a little bit about yourself?
I was raised mostly in Milwaukee, went to school in St. Paul, and then went to school in Madison. We moved here in 1989, so a lower transplant has been my life. Came here first to mental health services, and then after a few years went to Wright State in the Department of Psychiatry. And I developed a community psychiatry program with one of my colleagues there. Still did some clinical work at mental health over the years, and then 2013 went to the state hospital in Columbus. I thought I was going to be a staff psychiatrist there, but I eventually got arm twisted into some more administrative positions there as well. And retired from the state in 2020, but not quite retired yet. I'm doing some casual call work at mental health.
Thank you for sharing. Wow.
Yeah, we look forward to working with you.
And I would do that.
Thank you. Okay, moving on to old business. Construction and demolition debris license, Ms. Megan.
Yes, all right. So just this week, we received a letter of concurrence from the Ohio EPA, and a copy of the letter is in your packets tonight. So we're asking the board to approve the 2026 license for the Springfield landfill with two conditions. One is that in the beginning of the 2028 license, the owner needs to submit an annual ISOPatch and a cut, that's the cut fill drawing with the license application for both the facility's active and inactive license disposal areas to us. And then the second condition being that the owner shall submit an alternate final cap system demonstration to the licensing authority for the approval prior to the construction and certification of the final cap system. Basically the thickness standard of the cap that's intended to be utilized. So those two conditions need to be on the license. And then beginning in the license year of 2028, that annual cut fill drawing needs to be submitted with those applications.
Thank you. Can I have a motion and a second to approve the 2026 license for Springfield landfill with the two conditions that are listed that you have read?
So moved.
Second.
Okay, are there any questions?
I don't have a question, but just to tell you, we've been in continuous communication with Mr. Smith's consultant, Mike, who's been here once. He was just as excited as we are to put a bow on this for this year. And Mr. Smith, I think some of you were in here when Mr. Smith came in. He was going to come for the meeting. We just had a brief conversation, and he just wanted to express his thanks to the board for finally getting to the point where we can approve his license. You know, he expressed some things last month, that some frustrations, but things like this take time when, you know, you haven't done all the certain things in the code and the rules for a number of years. So hopefully he's on a good path for the future now. He knows what the expectations are.
And I believe you said he's aware of the stipulations and that have to
So
occur in 28.
the two letters that you have from the EPA, both his consultant, Mike, got it, and Tony did as well.
Okay. Any further discussion? Ms. Hackathorn, could you call the roll?
Ms. DeWitt,
Yes.
Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Ms. Johnson.
Yes.
Okay, motion carries. I'm very happy for him. Okay, moving on to new business, grant submission. Yes, Gracie.
Yes. So there is a grant submission summary in your packet. This grant application is for the regional prevention and linkages to care. So this is our overdose prevention grant that we are the regional leads for. So it's a 17 county region within the southwest part of Ohio. This is a continuation grant for $350,000. So it is to do local overdose prevention, but also across the region. So we contract with Butler, Greene, and Montgomery so they can have health navigators that increase the reach of the program. Like I said, it's continuation. We're applying for the 4th year of a 5-year cycle. So if you have any questions, I'd be happy to answer. It's through the Ohio Department of Health.
Okay. And is there, I'd like to have a motion and a second to authorize the health commissioner to do all things necessary, including submitting for the grant.
So moved.
Second.
Any questions, discussion? Ms. Hackathorn, could you call the roll, please?
Ms. Johnson,
Yes.
Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Ms. DeWitt.
Yes.
Okay, motion carries. Out-of-state travel, Mr. Cook.
In your packet, there are 5 out-of-state travel request forms, one for Gracie, Jeff, Lori, Emily, and Cheyenne, to be able to attend the NACCHO conference. That stands for National Association of City and County Health Officials. That's going to be drivable this year. It's in Louisville. A couple years ago, we went up to Detroit, drivable as well. But anytime it's drivable and we've got the grant funds to pay for it, we jump on it. It's an incredible conference. And again, being drivable makes it very affordable, frankly. The total you see, there will be, each page has a total, but I'm going to break it out for you how much is being charged to which grants. So we have a workforce grant that runs through November of 27 that we're able to use this money for. It's going to be a total of $5,972 billed to that. And then the WIC grant will pay for Emily, it's training, and that'll be $1,468 billed to that grant. So just ask for your approval for these 5 folks to go to that conference.
I have a motion and a second to approve the out-of-state travel and anticipated expenses for staff.
So moved. Second.
Okay, so I noticed that the amounts are different. Is it a discount if I'm not in leadership?
It's a discount, so for the first 2 people, it's a certain price, and then everybody after that, it's like $100 or $200 less.
Oh,
So
okay, that's
once
nice.
we eclipse the first 2, then everybody else. So I don't remember who I picked, to have
Be the person.
discounted price, but.
Well, that's very nice.
Mhm.
Okay. Any other questions? Okay. Ms. Hackathorn, roll, please.
Dr. Moore,
Yes.
Ms. DeWitt,
Yes.
Mr. Griffith,
Yes.
Ms. Johnson.
Yes.
Okay, motion carries. Delegation of authority to quarantine and isolate. Mr. Cook.
In your, on your iPads, your packet, you will see a document that's got some red lettering in it, and that's the one we're going to refer to. I'll actually refer to the last page. You can see I put the history of changes here, just so you can see this policy was originally adopted in 2004. It's modified in 2006, 2014, and now again in 2026. The red line changes are really a result of something I'll talk about in my report later. We did a measles tabletop exercise with our schools last week, and out of that came a little bit of homework for us. We wanted to firm up some of the language that was in here, not just specifically for measles, but for other diseases that we still retain isolation and quarantine responsibility for the public's health. So the first page, there's just a couple little things here and there. Some very brief language changes, putting the word Ohio in front of revised code, so there's no question about that. This is a policy I feel like needs to be very tight because it could be challenged at some point in time, as we kind of saw during the pandemic. The big bulk of the changes are really just replacement of previous sections 4, 5, and 6 with 2 new sections. So we consolidated those 2 sections, and you see it's actually less words. Instead of spelling out each individual disease here, what we're referring to is what's in the revised code as far as diseases that are listed in the administrative code in the revised code. Frankly, that not all the diseases that were in this previous policy are ones that we would isolate and quarantine for. So we're just referring to the current diseases that are listed in the code that we have a responsibility to isolate and quarantine for. We also got a little bit more specific in here about influenza A novel virus, and then any novel virus that can cause severe disease that may show characteristics of the ability to cause an epidemic, or may show the characteristics that could cause a public health emergency. So used a little bit better language than we had previously for sections, well, they'll end up being sections 4 and 5, but they appear as, actually they do appear as 4 and 5 on your red lined edition there. So really, again, just kind of firming up, getting a little bit more modern with the language that we're using here for the diseases that we should have that responsibility to isolate and quarantine for. So be happy to entertain questions that you have about this.
Okay, I have before you, I'm asking for a motion and a second to approve the updated delegation of authority to quarantine and isolation policy as presented.
So moved.
Second.
Okay, is there any questions or discussion?
I just have a question. I thought our combined health district was taken, we were changing that.
Yeah,
Or does
so
it have to go through something?
it's a DBA, and so our doing business as the
Doing
health,
business as.
right, Clark County Health Department. So
Okay.
we can use it interchangeably, but you will see on legal documents, you will
Uh-huh.
still continue to see Clark County Combined Health District. So contracts, policies like
Policies,
this that could
okay.
be legally challenged, they will still use that. We could use either one, but I just don't want there to be any questions, some technicality.
Okay.
We're going to stick with.
Just wanted to ask.
Yeah.
Okay.
Good question.
Very good question.
Thank you.
Okay. Any other questions? Okay. Could I have the roll call, please, Ms. Secretary?
Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Ms. Johnson,
Yes.
Ms. DeWitt.
Yes.
Certification of insufficient funds and levy renewal requests. Mr. Cook.
Well, if you've been around here for a little bit, you know that we have a levy that helps support our efforts, and we, every 5 years, we do something that's either renew or replace. Our most previous one, we did a replacement, but replacement levies, as you recall, be giving some legislative updates over the last year or so. Replacement levies are not a thing anymore, so our option is for renewal. We are going to run it this fall. It is 1 year early, so you can run it up to 1 year early. That would give us, in theory, 3 opportunities to pass it. So it'd be the fall of 26, the spring of 27, or the fall of 27. And so this is pretty much what our practice has been here for a number of years, giving us 3 opportunities to run it. And so we are, the process, and you kind of have to, you only do this every 5 years, so you kind of remind yourself what the process is. You all have to certify what's called insufficiency of funds. So if we didn't have the levy, we wouldn't be able to do all of our public health programs. I'll talk about that in a moment. That certification of an insufficiency by resolution by the board goes to the county commissioners. And they are bound by law. They don't really have an option. It's kind of the squirrely part of law. It says they shall certify it. It doesn't say we don't like that. We don't have to. So it goes to them. They make a resolution to the Board of Elections to put it on to the ballot. And so we are ahead of schedule. If you see in this letter that we're writing to the county commissioners, they have to get it to the Board of Elections by August 5th at 4 p.m. So I want to make sure we give ourselves plenty of time here in June to get it to the county commissioners where they'll put it on their meeting agenda and then get it to the Board of Elections to certify it by August 5th for November of this year. So sufficiency, insufficient funds, you might ask yourself what percentage of our budget our levy represents. It's about 26% of this year's budget. And that's just sheer dollars. Now, we could also say a lot of the other funds we get through grants also depend on that levy, because a lot of times you have to have match funds. If we didn't have a levy, have match funds, there's an opportunity that we could lose some grants. So it brings in much more than that 26%. It's a 1 mil levy. It's been a 1 mil levy for as far back as I've researched. It's a 5-year. We can have up to a 10-year, but we elected to go with a 5-year a number of years ago. We're going to continue to stick with the 5-year because if you change it to a 10-year, it becomes the language shifts to a new levy, even though it's the same amount. So we're going to continue to stay with the 5-year 1 mil renewal. So I don't expect everyone is a tax and property tax expert, although it feels like everybody is right now. But it's 1 mil is $1 on every $1,000 assessed value. If you take a look at your property tax bill or look on the county auditor's website, you can check and see how much that you're paying towards the health department, the library, the senior citizens, all those different places. I don't know if you've ever noticed, if you've looked, if you actually get your bill or if it's escrowed, the language on it is Clark County Health and Public Library Levy. It's together in one line, and I don't know why. I think this question has been asked in the past. I actually asked our county auditor that question by email today. I just did it earlier today. I haven't gotten a response back, but if you look at that dollar amount, it's kind of both the levies. It's the library and it's the health department together. And so I calculated out, so we're 1 mil of that kind of combined language on there. The library is 1.32 mils, in case you were curious about the breakout. So when you look at that total amount that's taxed, right, that's less of it is us than it is the library. When it comes to effective rate, just for your knowledge, it's a 35% assessed value. So you take the value and you're paying on 35% of that assessed value. It's actually less than that with the homestead, rollbacks, and a few other things. So it actually usually ends up being closer to 30% of your value that you're taxed on. And so for us, a 1 mil levy is 0.001 cents on every $1,000 of assessed value. We're a bargain. I'm going to tell you again. I'd encourage you to go look at your own property taxes, but we do a lot with a little. I will tell you that. Are there questions about this? Isn't like I said. This isn't the first time we've run a levy. A couple of newer folks on the board. Maybe this is your first go around with it, but procedurally, we have to certify that we want to continue with that levy, and that's called an insufficiency of funds resolution by the board.
This particular one wouldn't go into effect until 2028.
Correct.
Okay. And what's our board's policy on number of people you have to vote? Yes, if there's only 4 of us here, how many?
As long as we have a quorum, I think it is.
Majority or unanimous?
No, it's majority.
Okay. I don't know. This is just personal, but we're really trying to get a school levy passed. And so the more things that are on ballots, the harder it is to get things passed. And if this is super early for this one, then I don't know. Never mind, that's personal.
It's okay.
But,
That's okay. Our whole self comes with us.
oh yeah. Okay. And all we are doing today is saying that we do need to renew this
Correct.
by 2028.
Yes.
I have a question.
Okay.
You said that this levy, this 5-year 1 mil is 26% of the budget, but some grants are matching funds. Have you figured out how much, say it doesn't pass, how much would you lose in matching funds on top of the 26% of the budget?
The only one I know without looking today is the Public Health Emergency Preparedness Grant. We would lose the whole thing if we don't have a match. I think this year it's like 90, oh, just gonna look. It's somewhere around $100,000. Ish. That's the one I know off the top of my head, because that's when I have to sign that match agreement every single year when we get that grant.
26% would become some greater,
For sure.
okay?
Yeah. I don't know, sorry.
Okay.
And what we're doing by running it a year early, giving us 3 opportunities, that's something pretty much every agency does.
Okay, so I'm asking for a motion and a second to approve the resolution certifying that the amount of money necessary to meet the expenses of the health department will not be forthcoming to the Board of Health, out of the Health Fund for the years 2028 through 2032, and requesting that the county commissioner declare by resolution that it is necessary to levy a tax for the Board of Health and to place a 5-year 1.0 mil renewal levy on the November 2026 ballot.
So moved.
Second.
Are there any other questions? You look like you're thinking. Okay,
Good.
all right. Okay, can I have the roll, please, Ms. Hackathorn?
Ms. DeWitt,
Yes.
Mr. Griffith,
Yes.
Dr. Moore,
Yes.
Ms. Johnson.
No.
And isolation housing reimbursement, Mr. Cook.
In your packet, you'll find a couple of things, a memo from February of this year, and on the back of that, an email from Cheyenne to me. The high level summary of this is multiple times in the past, we have paid for a patient's who has to be isolated for a particular communicable disease, paid for their rent so they can continue to isolate in their home. Otherwise, we have a responsibility to provide housing, isolation housing. We have multiple people isolated right now in housing that we are paying for. If they don't have the ability to isolate at home. The opportunities to isolate at home are usually only if they live alone.
Right.
In this particular situation, we had someone that had a disease that we were required to isolate them for, who had been isolated out of work, obviously. They had to isolate and getting treatment for this disease for a period of time. And during that period of time, they were not able to work and had no income. They had enough savings to continue to pay their rent for a period of time, but they were out of money because they weren't working. And they were going to be evicted from where they were living and isolating. And so our options were pretty limited. We either had to find isolation housing, which frankly we didn't have any available, or we had an opportunity to continue to allow them to isolate there and pay for their rent for a month. $600 to pay for their rent was probably the most affordable way to do it. Otherwise, it's things like a hotel. It's $80 a night for a month. Finding some other rental place that we didn't have access to at the time. And so I made the decision to pay their rent for that month that they needed to isolate and finish out treatment. The problem is with a lot of these folks is they're subletting. So they're paying someone, who has a lease on a facility or an apartment or a house. And so when we say, hey, we're going to pay the rent, there's no person that we can get a W-9 from and cut a check to, because again, it's not a narrative on the legalities of it, but I needed this person to stay in this house, whatever arrangement they had for living there. And so this is the third time that we had done this, where I literally went down to my bank. I got $600 out. I paid the subletter so that they would they can continue to isolate there, and I submit for reimbursement through our normal processes. You would see it on, a fiscal report as an expenditure, as a reimbursement to me. And I do all things to prove that. I give Jeff a copy of my withdrawal, and when somebody witnesses me giving the money to the person that they're subletting from, and making sure, and most times they will handwrite a receipt out of sorts. And so this has worked 2 other times, and it's only really for emergency unique situations. And so we went to do this again because it was fine the first 2 times, but suddenly county auditor said, no, we're not going to do that, after I'd already done that. And so we've been going back and forth with them, and Jeff has given it a very valiant effort to do this over the last 4 months. And they continue to say, no, we're not going to process this reimbursement. And so we are taking another approach here. We're asking for you to have a resolution saying that you're authorizing reimbursement to me for $600. And because those expenses, as you'll read here, were incurred in the discharge of my duties. And one of my own duties is to isolate and quarantine. It's in the revised code, and I tried to do it in the most efficient, cost-effective way possible. So we're asking them to do this through resolution from the board. I think this is probably going to be the last time, because if they're pushing back, so we're going to find another way to do it. And frankly, it's going to be a less cost-effective. It's going to cost everybody more money. I'm going to have to put the person in a hotel and spend 2 to 3 times what I just paid for them to stay in their own home. And by the way, they'll probably lose that home because they're going to rent it out to somebody else. And but for now, I would like to get my $600 back.
Did they
Great.
give you any thoughts about why it was okay 2 other times and not this time?
I don't have a lot of detail
Oh, okay.
on the why it was okay in the past, but is not now.
Not now, okay.
It was shared with me that it is not okay because spending of taxpayer dollars requires a W-9. So that we assure that they go to somebody who's legally able to receive money in the United States. We don't have that in this case.
I see.
But ultimately, the money is going to Mr. Cook.
Right.
It is a.
Did they have
reimbursement.
any suggestions?
Not to do it again.
We even appealed to that piece of it. It's like, great, we won't do it again. Give me the $600. But that didn't work.
It was, as he said, it's happened twice in the past, and they've never said, at least to my knowledge, you got to find a different way to do this.
Mhm.
We're not going to do it again.
Mhm.
We've never gotten there.
Yeah.
And if they would have come out and said, hey, we're going to do it now, but we'll never do it again after,
Right.
we're not having this conversation. That stuff got bypassed.
Interesting. Okay.
Okay,
Since this was in March, is it to be assumed that the patient doesn't need any more assistance?
Correct. They had to finish out the month that they were in, and so they've been discharged.
so I'd like to have a motion and a second authorizing a reimbursement to the health commissioner in the total amount of $600 for expenses incurred for isolation and housing while discharging his duties under Ohio Revised Code 3701.146 during the month of February 2026, and directing the county auditor to pay this reimbursement from Fund 8244, but never again. Okay, all right.
So
Okay.
Second.
Interesting.
Could I have a vote, please?
Just real quick, Fund 8244 is a donation fund, and we have money from the Springfield Unity Fund specifically for things like this.
Thank you for letting us know that. Okay. Any further discussion? Okay. Ms. Hackathorn, did we add but never again in there? Okay, I just want to be clear. Okay.
Ms. DeWitt,
Yes.
Ms. Johnson,
Yes.
Dr. Moore,
Yes.
Mr. Griffith.
Yes.
Okay, motion carries. On to position upgrade. Ms. Lambert.
Let's see, sorry. Yes, please consider moving Elle Melander. She has achieved her home visitor 2 credential.
Okay, wonderful. We have a motion and second to upgrade Ms. Melander.
Melander, yep. Elle.
Melander, okay. From a home visitor 1 to a home visitor 2,
So moved.
effective July 6th.
So moved.
Second.
Any discussion or questions? Okay, could I have a roll call, please, Ms. Hackathorn?
Mr. Griffith,
Yes.
Ms. DeWitt,
Yes.
Ms. Johnson,
Yes.
Dr. Moore.
Yes. Okay. Staff changes.
Thank you. We have, as you can see, one resignation that is actually a transition. Our disease intervention specialist will be transitioning from full-time to intermittent. And we did not have any new hires, so there is no need for a vote.
Thank you. Financial reports, Mr. Jeff.
Sorry, 10 pages of vouchers and expenditures. Again, these are non-payroll expenses. They are broken down by fund. The total for the month is $461,000 or more. The only thing, appearance-wise, that may look different on this, you may notice that some are highlighted. I went to I took the liberty of highlighting the 10 greatest expenditures, just to kind of draw your eye to them. 3 of them on the first page. This is by far our most expensive month this year. 3 of them on the first page I'm going to just talk about briefly. Vital statistics technology fees and our tech advisors bill, that's $54,000 and almost $40,000 respectively. Those are quarterly expenses, so those they're regular but not month to month. And then the public entity pool, that is our insurance, that is an annual expense. So that's a one-time. Okay. The rest of the big expenditures are mostly vaccines or people that we contract with for services.
Okay, I'm asking for a motion and a second to approve the expenses and vouchers for May 2026.
So moved.
Any questions?
Second.
Oh.
No, I didn't, but.
So move second. Any questions? Okay, Ms. Hackathorn, roll call, please.
Ms. DeWitt,
Yes.
Mr. Griffith,
Yes.
Dr. Moore,
Yes.
Ms. Johnson.
Yes.
Okay, transfer advances, Mr. Jeff.
No unscheduled transfers or advances this month,
Okay,
or unbudgeted rather. Sorry.
okay, so we don't need an approval there. Okay. Monthly budget report.
The same 3 as usual. The revenue and expenditure report for 8201 general fund, those are the unrestricted funds. The cash basis report for all of our funds, including the monthly receipts and expenditures by fund, and then the new sheet of many colors, beginning cash balance for the year, annual receipts, annual expenditures, ending cash balance. The only one actually, I don't even need to talk about that one, sorry. Misspoke. Just a reminder of the highlight on the graphs, right? This year's revenue and expenses are both less than last year. Again, most of that is due to the enhanced operations grant that went away last March. And then that last page of the sheet of many colors are the transfers. Those transfers are taken out of the receipts or expenditures on the first page. I'm working on a better way of demonstrating that to you for next month. It's a better way of reporting, but it is a little bit misleading because if you look at, for example, the general fund, the very first line, it has it indicates that the ending cash balance is about 2.7 million, but it isn't. It looks that way because I'm backing the transfers out, but we have actually transferred money out of there. I need to do a better job of showing you how that happens, but then showing you what it would look like if the transfers hadn't happened. The funds that receive the cash are the ones that will really be impacted, and you'll actually see the difference next month.
So this looks like there is a huge deficit for nursing.
Correct. We had scheduled 1.09, so $1,090,000 for transfers into nursing. Prior to this year, nursing was a part of 8201, it was a part of the general fund. This year, we split it out on its own. A lot of the services we provide are not revenue centers, they're losers. But they're important services. It's vital to the community. But if you go back to the vouchers and look through there, 3 of our 10 biggest expenses this month were vaccines, which are being bought out of nursing. We have almost, I want to say, $525,000 in a purchase order just for supplies for nursing, which would include those vaccines.
Okay, so going forward, how are we going to reflect that? Because I do understand that that is not necessarily a money-making area, or is it cost?
It's never been money-making.
Right.
It's the reason that you're seeing it is it used to be in 8201 where we were seeding levy dollars to, almost $2.5 million. So the truth is more, not quite, probably about half of our levy funds nursing. That's the long and short of it. The levy money is receipted into 8201. We're pushing it into the nursing fund to make up the difference. That's kind of
In the future, will the budgets be written differently so that nursing starts with more money and then it won't look like a deficit where you have to transfer funds from the general fund into it?
So it's basically a zero balance fund. So I think we budgeted, there won't be much left at the end of the year in nursing. And so within the first couple weeks of January next year, we'll have to estimate about the same $500,000 is going to get dropped in there. We kind of planned it out to do it twice because we get two, I'm sorry, Jeff, I should just let you. We get 2 levy payments a year. We get one in February.
Yes.
And the second one is July-ish.
Yep.
So we try to time up, those transfers out of the general fund into the nursing fund now to make that up.
So when the next levy payment comes, that goes to take this out of the red?
Right.
I'm looking at it.
Already did it.
Okay.
Okay.
Yeah, it's our, this,
So if you,
Did you say?
they transferred 500
Oh, okay.
from the general fund into nursing, right?
correct.
Thank you for helping. us.
And that's, so if you look at,
Okay.
so the last 3 pages in your report are the sheet of many colors. And so if you look at the very colorful one and you look at the fund 8219, you see that it's lost for the year $495,000. If you look at the page right before that and you let your eyes, these are numerical orders, so you let your eyes wander down to 8219, and you look at the same spot, the ending cash balance, it appears that fund has made $4,375. That's all transfer. That's all money that we've taken from the general fund and put in there, which is why I'm trying to back out the transfers for the numbers that I present with you, because it gives you a truer view of what's going on in our funds. Right? I just need to figure out a better way to make it as transparent as possible.
Thank you. Thank you, Jeff.
You're very
And
welcome.
thank you, yes. Appreciate that. Okay. No action required there, yes. Public health team reports. Ms. Megan.
Hello. All right, so tonight I'd like to introduce Simone Watkins. So she just completed her probation with us. So Simone joined us back in December, and she has been a great addition to our team. She is an environmental health technician. So part of her job is clerical in the office, and the other part is out in the field. So while she's out in the field, she's checking, doing aerator inspections, real estate inspections, rabies observations, pretty much anything that we can have her do, she'll do for us. So prior to the health department, she worked at the Rocking Horse Center and was a stay-at-home mom. So she's been a great addition to the team. So wanted to invite her to have her introduce herself and you guys meet all of her. So next, I'd like to talk to you a little bit about the rabies program. You guys get our numbers every month in your board packet, but it just looks like a lot of numbers. So I believe it should be on the third page, top left corner. Under rabies control, you're going to see the animal bite investigations. We have seen a very large increase in our animal bite investigations. So just in the month of May, we had 51 investigations. So I went through some numbers this afternoon. It was kind of crazy. So that is 51 times that an inspector has been at a residence or property in Clark County observing at least one pet, cat or dog that was involved in a bite or a scratch incident that broke the skin. So therefore we have to quarantine the dog and observe it in 10 days. Year to date, we have completed 173 investigations. We pulled data from 2025 and in 2025 for the whole year, we reported 77 investigations. So we are, yeah, it's crazy. And I checked those numbers a few times because so this is obviously a significant increase, and we've received bite reports from medical providers and also local law enforcement agencies around. So though this program is mandated, it is an unfunded program. Our staff spends a lot of time working in the program from the observation on site, and then we have a lot of follow-up in regards to making sure the rabies vaccines are actually taking place by their required deadline. I also pulled some time that we spent last year in 2025. We spent about 294 hours in the program. And just this year alone, we spent over 200 hours. So we're spending a lot of time in the rabies program. But then also, you guys have heard a lot of, seen a lot in the news about bats in the area. So I also pulled some numbers to share with you for that. We've had a significant number of bats, an increase in our number of bats captured in Clark County. And that's either brought in by the residents of Clark County or we go out and capture them for the homeowners or for the residents. And it's when there's a possible human exposure that we want to get those bats captured and have them tested by ODH. So in 2025, we submitted 15 bats to ODH for testing. So far, year to date in 2026, we have already sent 14 bats. So of all the bats that we have sent to ODH, they all have tested negative for rabies. But we all have heard the news that there's several rabid bats in surrounding counties. So keeping an eye on it, but it stays away. Our last rabid bat was 2020. Just thought I'd share some numbers.
Well, thank you
It's a
very
lot.
much. Welcome, Simone. We're glad to have you as part of the team here. And are all of those bites that you guys get, are those pets or they are also some wild animals?
In the past, we have had some bites from like raccoons. Yeah,
But right now they're just pets.
most of the time, the majority of them are. The ordinance is cats, dogs, and ferrets. So
And ferrets?
ferrets.
Ferrets, okay.
Haven't had a ferret yet, but it's in there.
So you think this increase is driven just by the news?
For the bats,
And yeah, the big number.
potentially, but the animal bites, we don't really know. I don't know if it's better communication from, to our law enforcement officers to make sure the bites come to us with Avery's law going into effect. The dog warden has been more involved with things, so we're all kind of working together. But reporting has definitely increased.
I was gonna say I work at Medicine Health,
Yeah.
so it's Madison County.
Oh, yeah.
And we send our animal bite forms to the Madison but it says on there what, and I would assume that they get the
Yes.
information too. Anyway, sorry, we as policy, at the hospital, it's always been, you know, anytime somebody comes in, even if it was their own pet, you have to fill out this form, right? But I do also know that there was some increased educational requirements
There you go.
for some of our staff because they weren't doing that form every time they should perhaps. So
That could be
that
too.
could, I mean, that's gonna not increase
Yep.
a lot, but that might be something.
Could be. Okay. All right, any other questions for Ms. Megan? Nursing and clinics, Ms. Gracie.
Yes, I'm filling in for Cheyenne today. So you have Cheyenne's report that she submitted to the board packet in front of you. So if you have questions, I can try to answer them or get you an answer after the meeting. But the one thing I did want to point out, I know we didn't have any staff to approve for hiring, but there are 2 nursing positions currently open, looking for RNs or LPNs to work in our immunization clinic and our reproductive health and wellness clinic. So the nursing staff has been doing interviews, and we're hoping to get those filled soon, but those are the 2 open positions within the nursing division. So that was the biggest update Cheyenne wanted me to share, other than the report that you have in your packet.
Thank you.
Thank you.
All right, okay, thank you very much for that report. Ms. Lambert, early childhood.
Thank you. I'm paying attention this time. Since we were here last, we did learn that we got our Cribs for Kids grant application was approved, so that was really good. So that will continue to help support education and cribs for financially, families that have financial need in our community. One change this year is that it's switched from a federal fiscal year to a state fiscal year. So that means that we're starting here in a couple of weeks, which is July 1 already. This year in our application, we continue to collaborate with Champaign Health Department. But in addition, this year we added Madison County Health Department so that they will be passing out cribs and Madison County will be also. So that's good. Because the more families we can reach in the region, the, better we can improve infant health and reduce infant mortality. So that's good. And the grant was about $70,000.
Okay, thank you. I do have a question. So are we dividing those cribs up through the 3 counties, or do we have a different allotment for each of the counties?
Yeah, each will have a different allotment. And the bulk will be here, like 280 will probably be in Clark, but then Madison and Champaign will have their own allotment. It'll go right to their health districts.
Wonderful.
Yeah.
Okay. Thank you very much. Any other questions for Ms. Lambert? Okay. Women, infant, and children, Ms. Schaefer.
Thank you. I have 2 special guests in attendance this season, or this evening, who recently joined our WIC team. I'd like to introduce. First, we have Madison Jones. Madison is one of our certifying health professionals who started her journey with us in October. Madison comes to us as a recent graduate from Bluffton University with a master's degree in nutrition and dietetics. Her experience includes working at Dayton Children's Hospital as a clinical nutrition lab technician, along with numerous positions in customer service. Next, we have Abigail Stamball, who is one of our support clerks and has been with us since December. Abigail's experience includes working as a daycare teacher at Champaign Family YMCA and working with adults with developmental disabilities, where she would complete basic home health tests and care. And both Madison and Abigail have been wonderful additions to our team with their work ethic and pleasant demeanor. And I look forward to their continued growth and development in their role with us at WIC. So thank you, Madison and Abigail, for taking the time to be here this evening.
Thank you. We're glad you joined our team also.
And then I just have a couple more updates. Next, this week, the state office shared the Ohio WIC goals for 2027 and is seeking public feedback. So in the packet, I did have Shannon add the goals. There's 6 goals, And then plus there's a QR code that you can scan and put that feedback or submit feedback. And that just gives the public an opportunity to submit comments and feedback so they can be considered in the following year's state plan. So this has been posted in our office as well, so our participants can submit feedback. And then I also shared it with our community partners. So being in the Board of Health packet 2, this gives you all an opportunity to submit comments and feedback. And then lastly, at the end of September, the state sent us a customer service feedback poster. So we have this displayed in our office. It has a QR code. And this gives us an anonymous feedback on their participant experience. So fast forward to this week, we finally received our first result, and I just wanted to share that this evening. So it has 3 questions. It asks about what county the clinic was attended, how satisfied you were with the service, and why you answered that way. So the surveyor was highly satisfied and stated, every time I've been into the Clark County WIC office, I've been greeted with kindness and excellent customer service. And such a great experience where everyone there just loves kids and wants to help. I was extremely proud to receive this from the state and then share this with the staff. Recognizing a fantastic team and validating their efforts through customer feedback is highly rewarding. So I just want to take this time to thank our WIC team for helping make every experience a positive one. Your warmth, patience, and dedication do not go unnoticed. And the feedback we received.
Wonderful.
Thank you. That's all I have.
All right, thank you very much. Any questions for Ms. Schaefer? Okay. Health planning, Ms. Gracie.
Yes, so you have the health planning report in your packet. If you have any questions, I'd be happy to answer them. Just a few highlights. One is our annual summer camp life sports that we partner with the Springfield Promise neighborhood to actually conduct the camp is happening again in July. So that registration is open now, but it will take place at Lincoln Elementary from July. There's a little bit of a typo in the packet. It's July 6th through the 30th. July 5th is a Sunday. So it's going to start on that Monday. So it's Monday through Friday, 9 to 3, free camp. They get breakfast and lunch and learned life skills, but also the skills of soccer, basketball, and football. So very fun. We've done, this is, I think, like our, 5th or 6th year doing it. So grateful for partnering with Promise. They do a great job with that. And then the last page in your packet are pictures from the bike rodeo. So Springfield Police Department puts on a bike rodeo to learn bike safety and biking trail etiquette for youth in our community. And our health planning team partners with them to help plan it and run it and do all the things necessary to make the event go. So just like to add some pictures with that happened on the 5th of June. It was a very sunny day, but very hot, I was told. It was very, very hot. But they said all the kids really enjoyed it. And then the last thing, I just wanted to give you an update. Last month, Commissioner Ricketts mentioned that the City Commission was entertaining the enhancements to the tobacco retailer license policy that the city has. And as of Tuesday, it is officially passed with those enhancements that we talked about. So increased fines, increased application fees, proximity clauses to youth serving organizations. So we can't thank the City Commission enough for entertaining that and passing it. So we are ready to take on the same thing that we've been doing, but have a little bit more teeth behind it. So
I have just one question with the biking. Do you think they'll be adding the e-bike safety? Because those are really,
yeah, that's a great
Big.
question. I'm not sure,
yeah,
but I'll definitely ask.
because the increase of accidents and
Absolutely.
broken bones and head injuries
Yeah.
with e-bikes.
Yes. Yes.
So,
I see them
curious.
zipping around.
yeah.
So.
Okay, legislative, thank you, Ms. Gracie.
Mhm.
Legislative updates and Health Commission, comments, Mr. Clark.
Yeah. You've heard me talk way too much about House Bill 692, which was the sewage bill. There is now a House Bill 692 substitute bill that basically it made some concessions for public health stance on some of these items. It didn't get everything that we wanted, but it's better than where it started. So one of the biggest things was the soil analysis requirement for new systems. There is a lot of science involved in putting in designing a sewage system, and by potentially removing that soils analysis, we were going to probably have failing systems, way premature, and it really just kind of, I perceived it as an insult to our designers and our soil scientists, because there's a lot that goes into that. So that was the biggest thing on the table for Association of Ohio Health Commissioners. That's got to stay in there. It is in there in the substitute bill, but we had to make concessions in other areas. This is just how, it's not like Schoolhouse Rocks when the bill becomes the law, and that. There's a lot of stuff that happens that they didn't include in Schoolhouse Rocks. But the changes are in the substitute bill. The post-installation, 12-month post-installation inspection is now an educational assessment. It's not an actual inspection. The local operation and maintenance programs, you'll hear us say O&M programs, are now optional rather than mandatory. There is an Ohio Department of Health registration process for installers, service providers, and septic haulers, with 75% of the fees that they are collecting for that coming back to locals, which is a huge thing that is beneficial towards local health departments. And it takes there's a appeal process for sewage systems that used to sit locally, and now it's been pushed to the state with the Household Sewage Treatment System Technical Advisory Committee at the state. So we no longer retain the ability to do appeal hearings here. If someone doesn't like a system that was designed, we don't do it locally. It goes to the state now. So all in all, we kept the big one. The soils analysis stayed in. Some of the other ones, the O&M program going optional, this is, I fully believe, with the help of our lobbyists at AOHC, this is the best as we could expect to come out of this. So chances are that's going to continue to roll on and eventually be signed into law. I anticipate that happening in the next month or two. There is underway updates to the state law that has to do with lead and lead abatement. And so the changes that are being proposed actually make a little more stringent requirements on post-abatement clearance inspections. So that's the remaining lead or dust that's left after abatement. Gets a little bit tighter on those requirements, which is probably going to be a little bit more difficult for our contractors, but in the end is better for public health. So that's been proposed. They've also proposed a few things that public health lobbyists are kind of tipping their head to the side on. It increases license fees for contractors. It increases training costs that's mandatory. Some things that we already struggle to get folks and contractors to be able to do this kind of work legally with the right training. We have a little bit of a fear that these increases are going to just reduce that pool down a little bit even more. So there's some negotiation at the state level about making some adjustments to that, whether it's not an increase all at once, maybe it's spread over 5 years. So we'll see where that heads, but we're watching that one as well. A few other things outside of legislation. We expect this week or next week, the U.S. Supreme Court to rule on TPS for Haiti. We've been watching it. Actually, about an hour before the board meeting, I looked because there were some decisions that were coming out today. And I don't believe it when I looked, it hadn't been included, but I expect in the next week or so, we're going to see that ruling come out. So we're watching for that to see what that's going to mean for our population here in Springfield and Clark County. I do want to point out something that was in Shannon's report, the Vital Stats report, which I think is the very last page of your board packet. Shannon collected some really good information here, and I'm going to share it on her behalf. If you recall, we instituted the $10 fee for replacement of records back in April. Shannon's got some good numbers in here. So since we did that, we've had 4 birth certificates that have been replaced with the fee waived because there have been data entry errors pretty much on the hospital side of things. So we wanted to retain that ability to waive that fee in instances where, Shannon and her staff felt that it needed to be waived. There have been 7 replacements for death certificates due to pending cause of death updates. But of note, there have been 74 death certificate replacements that we did charge the $10 fee on. And primarily, as you see in here, data entry corrections by funeral homes, just working too fast or making mistakes. And some of those were costly mistakes because they ordered a bunch and we had to replace them all. So I just underscore this for 2 reasons. We retain the ability to waive it when it's nobody's fault, but we retain the ability to charge for it and recoup our costs, because I told you this could potentially be thousands of dollars a year, and here's $740 just since April. So I'm glad we did. Appreciate your support on that, and there's evidence to support that too. One of the things that we budget for out of what's called the MAC fund, the Medicaid Administrative Claiming Fund, is our levy dollars, our other fees that we get are for operations. We don't have a capital budget really. And so we tend to use that MAC fund that we get for those capital improvements. A couple years ago, we upgraded the HVAC system here. If you recall, that was when Charlie was still here. We've been trying to bank a little bit of it because frankly, I know we've got some big things like parking lots and roofs and things that we're gonna have to do. But one thing that we are pulling the trigger on and using some of those dollars for, I think it's very important, for this building is electronic door locks on all of our exterior doors. It's been something that we know we've needed for a while. A couple years ago, almost, when we had Homeland Security take a look at this building and we had threats on a lot of the buildings, that was one of the things they pointed out. So we are moving forward with that with tech advisors, using some of those capital dollars in the MAC fund to be able to do that. Again, a budgeted expense. It's gonna do a lot for our security, not just for getting in and out of the building, but right now, like when a staff member retires or resigns or leaves us, we have to go through the manual process of going through all these doors and recoding them. 2 times in the last year, we have had this door right here go down for at least a day or 2 because the technology is so old. Our maintenance staff work on it. They've taken it to a locksmith. It's been back and forth. That door is a disaster. And so with an electronic door system, we'll be able to say, hey, tech advisors, disable this person's badge, and they can't get in. Yes, it's 2026 and we're just now doing this. I know a lot of, thinking like hospitals and other places have had this, schools have had this for a long time. It's time for us to do it here. That exists at High Street. There's electronic keypad entry there. It's time to do it here. So I'm excited about that. And actually Tech Advisors is starting on it tomorrow. We're closed tomorrow for Juneteenth, but they're going to be here starting work on it in this building. So I'm excited about that. Health insurance. So you all gave me the okay to move forward with employee health insurance and negotiate that. We ended up, I think, in a good spot, better than where we started. Just the bottom line, we had budgeted this year for an increase of about $116,000 to our budget in premiums that we were paying as the health department, and we came in right at about $98,000 of an increase. So just slightly under budget. I think we've got a good product for the employees. We are moving away from Anthem. So we did the bidding process and we are moving to United Healthcare, and a little bit of a change in our plans. We still have 2 different types of plans, a high deductible HSA plan, but we also had and still have the version of a PPO plan, but this is through United Healthcare. It's called the Surest plan. A lot of hospitals are moving to this. I think you're going to hear more and more about these Surest plans. Bottom line, for people getting that plan as compared to last year, it's actually a premium decrease, believe it or not. And for our high deductible HSA folks, they have a little bit of an increase ranging from $12 a month to $37 a month to maintain that plan. So we, as I told the staff, we budget, we try to stand in front of them as much as possible to take as much of that hit that happens every single year with premium increases, pass a little bit along to them, using fixed numbers instead of floating numbers that we had in the past. We ask staff to contribute whatever plan that they select at a certain fixed percent across the board, and we pick up the rest. So to give you an idea of that, if you're on the high deductible plan, staff are paying 5.5%. We're picking up that other 94.5%. And then on the Surest plan, staff pay 8.5% of that premium. So we ended up in a good spot. And if you'd asked me a couple months ago when we started this process, I would probably been a lot more nervous, but we ended up within budget, slightly under budget, and I think a good product for the staff to have as well. Last item for tonight is I mentioned, I gave you a little teaser earlier when I was talking about the update to our authority to isolate and quarantine, that came out of a measles tabletop exercise that we did with the schools. So we had 7 schools that participated in an exercise last week. We held it out at the ESC. And we have been doing tabletop exercises in public health for a very long time. Other entities and organizations do them as well. But it is kind of to take day by day the schools through what would happen if we had a case of measles, and what that means for isolation, quarantine, and exclusion from schools. And so we have this whole great scenario written out. A lot of appreciation to our communicable disease team, but especially Anna Jean Sauter on our staff. She wrote a lot of the exercise. Gracie was there. Again, we had a lot of our staff there to talk about what we would do. And really a lot of it was to pull back the curtain so the schools could see everything that we do on our side of things and talk through things with them that maybe they hadn't thought about. Because I will tell you, I hate to speak it into existence. I hope I'm not. But with measles, it's not if, but when. You continue to see cases. We're on pace this year to have more cases than we have in the last 20 years combined. So it is a concern. It continues to be a concern. And the more prepared our schools are, the better. Because that's probably going to be one of the most complex things to handle in our community is in our schools. That's it for me tonight, unless you have questions.
I do have a question. And so when you said the appeal, if I don't like my septic system design and I need to appeal that, I have to now not do that through us?
No. So it doesn't affect variance requests.
Darn
Yeah, sorry, you're still stuck with those. Sorry.
I got the same question.
Do you?
Have you ever been a part of a sewage appeal? I don't think I have here. I have in another county. Yeah, it doesn't happen very often.
No.
Well, I guess I have no questions.
Sorry.
Okay, any additional business? Anyone? Okay. All right, so we do need to set a date for our regular meeting because it appears that there are going to be a lot of people missing for our scheduled date.
That's when everyone's gonna be at that NACCHO conference.
Right.
So you'll see on this side of the room, it'll be me and Shannon, and on that side, it'll be Megan.
Okay.
If we keep with our regular third Thursday. So.
Okay. If that is not, well, we can move it to the 4th Thursday, if that is
23rd.
agreeable
It's
to.
not yet the fair. I looked at that because I thought maybe that might happen.
Right, it's the
Clark County Fair
23rd.
No,
It
it's
is
not.
the fair?
The
It's the
23rd.
23rd
Clark County Fair
Oh.
starts on Friday the 20th.
on the
Yeah.
24th.
Oh, okay. Thank you.
Good.
I didn't think about that. I've seen the signs already, and I just didn't pay attention to the date.
Okay. So we are in agreement to move to the 23rd of July. Is that what I'm hearing?
Yes.
Yes. Okay. So July 23rd. Do we want to keep the same time? Yes. Okay. And I think when Mike comes back, because Mike wanted to propose another time, so we can have that discussion when he's back. No. No. Adjournment.
Why don't
Would
you
you
go
have
ahead and
something
do a
else?
voice vote on the date? It's not written on your green sheet, but I think you probably should, since we're changing it.
Okay.
So moved.
I moved
Can
it.
I get,
So moved.
all right,
To move
For the
meeting to
23rd.
23rd.
all right, is there any discussion? Okay, can we get a vote? Voice, all in favor, say aye.
Aye.
Aye. All opposed, same sign. Okay, motion carries. Vote carries. Okay. Now it's official. Let's see here. We do not need executive session. And so I am looking for an adjournment. Does anybody have any objections? Could I get a motion?
So
Second?
Second.
And is there any questions about adjourning? No? Can I get a voice vote? All
Aye.
in favor, say aye.
Aye.
Opposed, same sign. Okay, I think we're adjourned. Thank you. It's been a pleasure.